give you a short introduction. Probably the speakers do not need any kind of introduction because their research itself in their respective field is so loud enough that it is very vocal.
So just a minute, just a minute. We are going live after we just start. I will tell you when it goes live.
I think you already gave a count, right? I'm so sorry.
Yeah, but it was the system here is getting a little bit. Just a minute.
We are live on YouTube, Jayesh.
Oh, okay, sir.
So actually, we have to update the link on backend, so that's why we are just waiting. So once the link gets updated on backend, so it will be live on all the platforms. Sorry for that. Yeah, we are just doing that.
Right, no worries.
Yes, sir.
Hello.
Yes, sir.
You are live now.
Okay. Okay, so should I start, Saurabh, in that case?
Yes, sir. Yes, sir. You can start.
Okay, fine. Right. So very good evening and namaskar from Eisai Pharmaceuticals India Private Limited. And we welcome all the delegates over here for an interesting talk, which is not so commonly been discussed. And that is Somno metabolic syndrome, a relationship between sleep and metabolic disorders. To bring the discussion on the table, we have the eminent speakers from the field of endocrinology and internal medicine. I'm sure the speakers for tonight needs no introduction because their research in their respective field itself is loud enough to give their introduction. Still, to complete the formality, I will introduce Dr. Sanjay Kalra. Dr. Sanjay Kalra is the founder of Bharti Hospital, Karnal, Haryana. Sir has been an advocate for human-centric hormonal therapy. Sir has received his medical degree from CMC Ludhiana and MD medicine from PGI Rohtak. Sir has completed his fellowship in endocrinology and metabolism and from the AIIMS New Delhi. Further, Sir has been associated as past president for Endocrine Society of India and is currently the president-elect for South Asian Federation of Endocrine Societies. Sir is also an active board member of Indian International Society of Endocrinology and is president of Indian Professional Association of Transgender Health. Sir also serves as a part of the research committee of Research Society for Studies of Diabetes in India and has over 1,000 publications indexed to his name and has fostered bilateral and multilateral links between various Afro-Asian countries in the field of endocrinology. Our next speaker for tonight is Dr. Sandeep Suri. Dr. Sandeep Suri is MD Medicine from PGI Rohtak, is currently the president of IPA Haryana chapter. Sir has many fellowships in diabetes management from CMC Vellore. Sir has fellowship in diabetic foot management from IPA. And Sir is also a fellow member of Indian Podiatry Association. Sir has various accolades and awards accredited to his name. To name a few, Sir is recipient of Diabetes Awareness Award at Diabetes India 2018. Sir is a gold medalist at CMC Vellore. Sir has an award for excellence in diabetes care at RSSDI 2019. Sir is a life member of societies of India like API, ESI, RSSDI, DIPSI, DFSI, IS, CCM. And Sir is also an international member of ISPAD, ADA, and ACE. Further to this, I would request Dr. Kalra to take up the processions. And with this, we can start with our discussions for tonight.
Thank you, Jayesh, and good evening, everybody. सबको नमस्कार, good evening, Ram Ram जी. आज के हमारे KK Med Talks को शो का थोड़ा सा न्यू लुक है, like you must have realized, but we are the same old friendly endocrinologists, the same familiar endocrinologists, the same familiar faces. और आज का हमारा टॉपिक है डॉक्टर KK Med Talks का Thursdays with डॉक्टर संजय कालरा का. आज का हमारा टॉपिक है Somno metabolic syndrome. ये तो खूब भारी भरकम अंग्रेजी हो गई. Somno, which means sleep, metabolic हम बार-बार डिस्कस करते हैं, और syndrome means a group of things which occurs together. बट इसके बारे में टू लर्न मोर अबाउट स्लीप एंड मेटाबॉलिक सिंड्रोम हमारे एक बहुत धांसू से स्पीकर हैं, आज हमारे स्पेशल से गेस्ट हैं, उनको भी इंट्रोड्यूस करते हैं. बट जैसे हमारा ट्रेडिशन है, लेट्स हैव द हेडलाइंस फॉर टुडे. The National Health Mission has engaged 2.71 lakh additional health personnel in 2020 to 2021. So that means actually the government is working very hard to take health to every doorstep. Practo insights have revealed that there is a 200% increase in queries on heart attacks in the last 3 months. So suddenly something has happened in the country. अब लोग ज़्यादा जागरूक हैं, ज़्यादा चिंतित भी हैं. And tomorrow is World Heart Day. So it is relevant also, and it is rational that we think more about heart diseases and then we work to prevent it. इसके बारे में भी हम आज के स्पीकर से जानेंगे. The government has invoked the National Medical Commission Act provision and has extended the time for holding the next exam, जो MD admission का होता है, up till September 2024. Tobacco is a major risk for heart disease. ये पहले भी पता था, पर अब new studies आ रही हैं जो बता रही हैं the risk is more than what we had thought of earlier. And the stethoscope can detect heart defects in children with 95% accuracy. And with this last bit of news, we come to our expert for today, जो कि actually stethoscope में expert हैं, someone who is very well known. Warm welcome, Dr. Sandeep Suri.
Thank you.
Dr. Sandeep Suri is a senior diabetologist and physician at the Holy Health Hospital in Hisar, Haryana. He believes in healthcare based on a personal commitment. He believes in humanized healthcare, and he believes in therapy by the ear. तो वो अपने कानों से सुनते हैं, स्टेथोस्कोप के साथ भी और कानों के साथ भी सुनते हैं. He is associated with the Public Health Foundation of India and also with the National Diabetes Educator Program. And बाकी जयेश जी ने तो इनको इंट्रोड्यूस किया ही है. So warm welcome, Dr. Suri.
Thank you. Thank you. Good evening, friends. Good evening. Good evening, Dr. Sanjay. Good evening, Desh.
डॉक्टर साहब, आज का हमारा टॉपिक है सोमनो मेटाबॉलिक सिंड्रोम या स्लीप एंड मेटाबॉलिज्म. तो एक एक करके इसको डिस्कस करेंगे, इसका व्यास करेंगे. व्हाट इज अ सिंड्रोम, व्हाट इज मेटाबॉलिज्म, व्हाट इज स्लीप?
Yes. So, देखिए, निद्रा जिसे स्लीप बोलते हैं, it's a very essential part of our life. 1/3 of human life is basically we spend in sleep. So very, very essential, not only for human being, any living being, even a single cell structure, single cell living being, plants, flies, everything requires sleep. And sleep is a sort of repair. It's a sort of, you can say it's a homeostatic method that when your body recovers, when your body recharges again to take care of the stresses, take care of the activities in the morning. So it's a circadian rhythm, that is the daytime cycle, nighttime cycle, that is circadian rhythm. And also there is a clock system that is there inside. So once that gets disturbed, then whole harmony, that the hormonal secretion of various organs functioning, endocrine glands, they get disturbed. And everything is basically so much nicely programmed कि दिन में जो चीज होनी चाहिए वो दिन में होनी चाहिए, जो रात में होना चाहिए वो रात में होना चाहिए. जो हमारी बॉडी में दिन में चेंजेस आते हैं वो अलग हैं, रात को जो हार्मोन्स होते हैं वो अलग हैं, उनका पर्पस अलग है, रात वालों का पर्पस बिल्कुल अलग है. और ये अगर ये हम बैलेंस बिगाड़ देते हैं तो दैट लीड्स टू ए सिंड्रोम दैट इज नोन एज सोमनो मेटाबॉलिक सिंड्रोम. And that is somnoendocrinology, which we are going to discuss today. It's a newer topic, and more research is being put on this, because as Dr. Sanjay has given you that the number of patients with coronary artery disease, MI patients, inquiry related to that is increasing. And we are perceiving that it has become a big issue for all of us. Young onset coronary related deaths are very, very common in our own prospect. You just look at the age of the patient sitting in front of you, and they have got 2 or 3 stents inside. So they have crossed 30 years and they have got stents inside. We are looking at diabetes occurring at the age of 15, 20. So even pediatrician must know how to take care of type 2 diabetes now. So the things have changed. It is 10, 15 years before the earlier age group which we used to treat, which we used to think that they are having diabetes, they are having coronaries. So everything has changed. It is basically the environment which has changed. Genes has not changed. It's our environment we have changed. And the environmental effect on our hormones, the sleep is one part which is directly related to the environmental cues. Just a simple light cue that indicates that ab din ho gaya. So that light cue is very important. So इस तरह से हमारी बॉडी एक तरह का हार्मोनस सिस्टम में रहती है, हार्मोनियस सिस्टम में रहती है, अगर हम अपना स्लीप डे टाइम साइकिल प्रॉपर मेंटेन करते हैं. एंड वंस दिस इज डिस्टर्ब, एवरीथिंग गेट्स डिस्टर्ब.
पॉइंट वेल टेकन डॉक्टर साहब। तो जो आप कह रहे हैं कि जो सूरज और चांद का जो साइकिल है डे और नाइट का, एंड दैट इज द सर्केडियन रिदम, जब हम इसको रिस्पेक्ट नहीं करते तो गड़बड़ होती है।
Yes.
And we are gathered from all across our great nation and beyond. I am reminded of the religion which is followed in Arunachal Pradesh, and that is Doni Polo, जिसमें वो सूरज और चांद की पूजा करते हैं। And now suddenly what I realize is कि क्योंकि हमने सूरज और चांद को इज्जत देनी कम कर दी, इसलिए ये डिजीजेस आ रही हैं।
Yes.
And we have started now, Dr. Suri, but the questions have been pouring in for the past 2 hours or so, and Dr. Kundar and Dr. Murari say, what is somno-metabolic syndrome? तो आपने already Dr. Kundar Sharma जी का जवाब दे दिया कि somno-metabolic syndrome वो metabolic disturbances हैं जो होती हैं जब हम sleep cycle को respect नहीं करते। एक और question आ रहा है, this is coming from Sanjay Kalra. How do you diagnose sleep health? मतलब आप अपने पेशेंट से कैसे पूछते हैं कि आपकी नींद ठीक थी कि नहीं ठीक थी, आप अच्छे से सोए कि नहीं सोए? ये अच्छे की डेफिनेशन क्या होती है?
बिल्कुल, ये बहुत इंपॉर्टेंट है, वेरी वेरी इंपॉर्टेंट, एंड मोस्ट ऑफ अस वी डोंट पे अटेंशन टू दिस। सबसे पहला ये पूछना चाहिए कि आपको रात को नींद ठीक आती है कि नहीं। तो ठीक की बड़ी भारी डेफिनेशन है। एक तो सही समय पे नींद आ जाती है कि नहीं। इंडक्शन ऑफ स्लीप शुड बी प्रॉपर, दैट मीन्स कि आपको उसके लिए स्ट्रगल नहीं करना पड़ना चाहिए। इट शुड बी स्पॉन्टेनियस। अपने आप लेटे थोड़ी देर में आपको जैसे जैसे आपका ब्रेन शांत होना शुरू होता है तो आप निद्रा में जाना शुरू हो जाते हो। एंड देन आपको ये पूछना है कि वो बीच में टूटती है कि नहीं टूटती, यानी इन बिटवीन देयर आर ब्रेक्स और नॉट। अगर वो टूटती है तो किस पर्पस से टूटती है? या तो पैरों में दर्द शुरू हो जाता है, या बेचैनी शुरू हो जाती है, या कोई ख्याल आने शुरू होते हैं, या आप बार बार यूरिन के लिए उठते हो। दैट इट ऑल्सो हैपेंस इन डायबिटिक पेशेंट्स। एंड उसके बाद ये देखना है कि आपको उस स्लीप के साथ सुबह जब आप उठते हो तो ड्यूरेशन इंपॉर्टेंट है, कितनी देर तक आप नींद आई, कैसी स्लीप आई, क्वालिटी ऑफ स्लीप, what were the dreams, what were the experience of the sleep during the sleep period, induction, duration, contact, and the total breakthrough in between that there is a breakage or not, and early morning जब आप morning में जब आप उठते हो how you are feeling। अगर आपको अच्छी नींद आती है तो you will feel fresh, you will feel energetic, and you will feel that I should go to work now and I'm okay, I'm feeling relaxed now. The purpose of sleep is over. So that indicates the good quality of sleep. And also, this is important that you must the other partner, your spouse, must also be asked about the quality of sleep. Because sometimes you are sleeping, you are okay yourself, but you are snoring a lot, you are moving a lot, you are gasping for air a lot. So that means you are sleeping. In between there will be interruption. You may not be knowing it, and early morning you may not be remembering that these things happen. So बहुत सारे लोग, हम लोग जैसे खराटे आते हैं तो वो हमारी जो वाइफ्स हैं या हमारे जो हमारे हस्बैंड्स हैं वही हमें बोलते हैं कि ये तो बहुत खराटे लेते हैं, इनके साथ तो सोना ही मुश्किल है। और आप लोग सुबह उठ के कहते हो कि हमने तो कोई खराटे लिए ही नहीं, हमें तो कोई आवाज ही नहीं पड़ी उसकी, हम तो बिल्कुल आराम से सो रहे थे। So that means you forget everything what happens. It's a subconscious thing which is happening. Your consciousness is over. You were sleeping at that time. So the quality of sleep is also important. Also important. So this whole things makes a structured sleep.
तो जो हिस्ट्री लेनी है उसमें जो साहिल जी ने क्वेश्चन पूछा उसका आंसर है कि एक तो आपकी क्वालिटी, हाउ डू यू फील व्हेन यू गो टू स्लीप, हाउ डू यू फील ड्यूरिंग द नाइट, एंड हाउ डू यू फील व्हेन यू वेक अप, डू यू फील रिफ्रेश्ड, एंड नॉट ओनली दैट, हाउ डज योर स्पाउस और पार्टनर फील ड्यूरिंग द नाइट। और डॉक्टर सूरी ने ये भी कहा कि अगर रात को बार बार उठना पड़े, द क्वालिटी ऑफ स्लीप कैन बी एसोसिएटेड विद डायबिटीज। He also talked about snoring, and एक डिजीज है obstructive sleep apnea, इसके बारे में भी बाद में बात करते हैं। And low sugar can also be associated with poor quality of sleep. तो डॉक्टर साहब क्वेश्चन आ रहा है डॉक्टर सेल्वम से, what can happen to sleep in a person who experiences low glucose or hypoglycemia at night? क्या symptoms हो सकते हैं?
See, hypoglycemia at night is a very very dangerous condition. We call it a nocturnal hypoglycemia. At that time, your protective responses are not there. Your protective responses of sympathetic nervous system, they are not there. And you are not able to take care of yourself. You are not able to take care of those warning signals will not be there. And you are sleeping and your blood sugar goes down and you will be having neuroglycopenic symptoms. So there can be various symptoms. Initially, you can have abnormal movements. There can be abnormal movements can be there, and you can have myoclonic jerks. You can have also profuse sweating. Patient can have profuse sweating. You should ask this history also. If there is wetting of the bed sheets or clothes or pillow covers, they become wet. Also, you will be very irritable. You will be very irritable. You will have bad dreams. The patient, you can ask your patient that bad dreams, कैसे कैसे सपने आते हैं. Sometimes you will wake up and have a cry or something. ऐसा लगता है कि कुछ बहुत ही बुरा हो गया उनके साथ. So that type happens in type 1 diabetic patients. And early morning, once they wake up, they feel very weak. They feel there is a heaviness in the head or there is headache, and they don't feel that they should go to the school. So that is it's not a good sign. And we must inquire about nocturnal hypoglycemia, because at that time you may not be having those glucometers or blood sugar will not be checked, and your parents, the child parents may not be knowing what is happening. So you have to educate them also that this can happen. Specifically, it depends upon the type of insulin you are using, meal pattern also, type of exercise you are doing. So all these things go in hand, and that can lead to nocturnal hypoglycemia. So it's a very, very important to pick nocturnal hypoglycemia. Simply, your patient can have seizures and may become unconscious and can even brain death, even cardiac arrhythmias can be there in nocturnal hypoglycemia.
तो सवाल तरन्नुम जी पूछ रहे हैं और संतोष जी, डिटेल्स अबाउट सोमनो मेटाबॉलिक सिंड्रोम. एंड बहुत अच्छा लग रहा है डॉक्टर सूरी आपसे बात करके. हर सेंटेंस में आप एक एक परत खोलते जा रहे हैं सोमनो मेटाबॉलिक सिंड्रोम की. तो काफी गहराई वाला सिंड्रोम है ये.
Yes, definitely. It involves everything. It involves all organs of our body, because if you see the circadian clock, that is the pacemaker of circadian, that is there in the brain. But the whole of the body system, all organs, they have got their own biological clock system. And most of these two clock system, biological clock system and the circadian rhythm clock system, both go hand in hand in most of the time. But once they get break, once they are disharmony in between these two systems, and they also work in independent, but most of them, they work in cohesion. But sometimes if there is a disharmony in between these, then there can be problems. There can be diseases, and so many metabolic diseases. Sleep is one of the biggest cause, because if you see that the amount of decrease in sleep is a big, that means more around 50%, 45 to 50% young adults, and even in adolescent and childhood sleep is also where we used to say that कि बच्चों की तरह सोना तो मतलब कि बहुत भाग्यवान लोगों को नसीब होता है जब वो घोड़े बेच के सो जाते हैं. But I think now this proverb घोड़े बेच के सोने वाला तो हम सबके लिए खत्म हो गया. So we are not into that era of घोड़े बेच के सोने वाला. So we are into era of 4.5 and 5 hours sleep, not 6 hours sleep. And that is the duration of sleep, and quantity and quality of sleep all has gone down, and that is a big issue with our metabolic health.
Right. रमेश खत्री जी पूछ रहे हैं, ये घोड़े बेचने वाला तो आप घोड़े या गधे बाद में डिस्कस करते हैं, बट दोपहर की स्लीपिंग. सो हिज क्वेश्चन इज आफ्टरनून नैप, is it good for health? Does it increase cardiovascular risk, or does it reduce cardiovascular risk?
See, that we call it a energy nap, and that also improves your benefit. That is also beneficial. A small short nap after the lunch meal, that also that is good thing, that can be added to the duration of sleep. So that total duration of sleep should be 6 to 8 hours. So that you can add it into that, and that is a very good energy nap.
Thanks to you from Dr. Apurva Biswas, and request from Annamalai ji to speak in English and Hindi both. So yes. We apologize, Mr. Dr. Annamalai, for that. We'll be doing both, and rest assured, everything will be translated in both languages. Yes. So we are talking about Somno metabolic syndrome, and what Dr. Suri said was that this is the relationship of sleep and metabolic disorders. If you do not respect the circadian clock, you do not respect the sun and the moon, you actually end up having more metabolic disease. And in our country, we are no stranger to that. हमारे देश में ढोल बज रहे हैं, डंके बज रहे हैं metabolic syndrome के. So let's ask Dr. Suri this question. What happens? Supposing I don't sleep well, what happens to my hormones early morning? What kind of hormones get liberated? What impact does that have on my diabetes or glucose control? क्या असर पड़ता है vascular system पे, what happens to my blood vessels? Does anything happen to my heart? दिल को भी कुछ होता है क्या?
Yes, yes. Sleep, there are two type of hormones if you divide the sleep hormones and the daytime hormones. So, and what happens in the morning, it is taking meals, food intake, body temperature increases, heart rate increases, respiratory rate increases, muscular activity increases, and your body is active and moving for the job or the work you are to do. So sympathetic nervous system activity is there. And at the night, parasympathetic nervous system activity should be there. So there are two types of system, sympathetic and parasympathetic nervous system. So if there is continuous increase in sympathetic tone, even at the time of night, and the levels of catecholamines, these are the hormones, and noradrenaline, catecholamine, these levels are on higher side. Obviously, they are going to be toxic to your blood vessels, toxic to your heart, and toxic to your body. So that constant increase in fight and flight type of hormones can lead to problem. Your body will be in a constant state of increased heart rate. Obviously, you will be putting more load on your heart. Your vessels will be more loaded, and there will be more oxidative stress. Your endothelial dysfunction will be there, and all things. I don't want to complicate with the whole pathophysiology, but that leads to increased atherosclerosis, and problems will be there. And that also, there are other hormones like leptin. Leptin is a hormone which is produced from your adipose tissue, and it is an anorexic hormone. It gives a signal ki ab khana band kar dijiye, and also it increases your energy expenditure. But once the sleep duration goes down and just below 6 hours, leptin level can be on higher side, can be on lower side, and lower leptins are abnormal, and higher leptin can lead to leptin resistance. Then another hormone, that is ghrelin, that is coming from your stomach, that increases during the daytime. And once the sleep duration is less than 6 hours, there is increase in ghrelin level. And ghrelin level also indicate that you should increase your food intake, grahan karna.
Makes you hungry.
Also, yes, that makes you hungry. Then GLP-1 is very important hormone or a neurotransmitter which we have. This leads to satiety, and it leads to anorexic stimuli, and also it improves your food choices. But GLP-1 level also go down once there is less than 6 hours sleep. Another, there is increased free fatty acid secretion, free fatties, or there will be more lipolysis. That also leads to increased insulin resistance. Beta cell dysfunction will be there. There will be more lipotoxicity, or more gluconeogenesis will be there. Inflammatory markers like interleukin 6 and TNF alpha, all will be aggravated once there is sleep, short sleep, that is less than 6 hours. And sympathetic nervous system, I already told you that it goes up. And all these hormones are basically they working together, and they are insulin resistance hormone. They are against insulin. Cortisol, growth hormone, catecholamines, they are all against insulin. So insulin is one hormone which leads to decrease in blood sugar level. And now you have got the increased amount of counter-regulatory hormone. These are counter-regulatory hormones. And they will lead to more blood sugars. Higher blood sugars will be there. There will be more insulin resistance, more stress on your beta cells. Obesogenic hormones will be there, and you will have metabolic syndrome.
Dr. Mangesh Tewaskar hain. He was earlier secretary of API, and now
good
he
evening,
is
sir. Good evening, sir.
And now he is editor of JAPI. He calls this the metabolic orchestra. So जो Dr. Sandeep Suri describe कर रहे हैं, what he is describing is number one, an autonomic orchestra, parasympathetic, sympathetic. If they play together in balance, then you get music. But if it becomes imbalanced, then you get noise. Metabolic orchestra and all these hormones. So ghrelin means greedy. Too much of ghrelin will make you a greedy boy.
Yes.
Now, too much of leptin, if it acts, will keep you lean. But if there is leptin resistance, then you become obese.
Yeah.
So we are learning so much now about the neurological and the metabolic and the hormonal impacts of sleep. If you sleep well, all this metabolic orchestra will play music. But if you don't sleep well, then you get in trouble. Just like Dr. Ramesh asked about afternoon napping, एक और question आ रहा है. ये आता है from Unni ji. employees who work in night shifts, जो लोग रात को काम करते हैं, दिन में सोते हैं, या they have different shifts, how do they manage? Is there an impact on their health? Any studies?
Yes, definitely. Shift workers, they definitely have an impact. They are always at high risk of cardiovascular disease. They are always at high risk of obesity. And they have to be very, very intelligent, very intelligent, because they have to maintain that 6 to 8 hours of sleep. Nighttime, they are working, okay. But once they come back from the work at in the early mornings or in the mid-morning, they should try to sleep properly, and they should create a total environment where the night time, that low light, absolutely dim light, off your mobiles and everything, and don't do any work also, then lie down properly, just your brain feel that you are in a sleep. This you have to do it, and you have to create an environment, because what happens, you are working at night, and daytime, once you come back, you are doing some job, so you are doing working, you are having some household work or something more, and you are limited to only 4 hours sleep, and that is in the evening hours. I have seen most of them, they are sleeping after 3 p.m. and up to 6 p.m. They are 6 or 7 p.m. they are sleeping, and after that they have to prepare themselves and they have to go to the work. So that is very shortened sleep time, and that leads to problems. You see the shift workers, they are having higher risk of developing diabetes, high risk of hypertension, obesity, and also high risk of stroke and coronary artery disease. They are very high risk in shift workers. And jet lag, even simple jet lag of, you can say 12 hours or 15 hours or 20 hours of jet lag, just like your shift workers.
So that also partly answers the question by Dr. Asfaq. Asfaq ji पूछते हैं, आपने jet lag की बात की. You spoke about jet lag, Dr. Suri. That is aeroplane traveling. Yeah, travel by air. From Dr. Asfaq, we have this question: what about people who sleep in buses? And we are assuming that he is not talking about the bus conductors or the bus drivers. So I think we've lost Dr. Suri.
Yes.
Yeah.
Yes.
Dr. Suri, what we had just now in the connection, that was like REM and NREM sleep.
Yes.
So we
hello.
Yeah, you are with us. Now we are in NREM mode.
Okay. Yes. So NREM and REM mode. This is a non-rapid eye movement sleep and rapid eye movement sleep. These are the various stages of sleep, and it starts once you are awake. It is known as alpha cells, which alpha wave, which are there in EEG. So at that time, it is low. It's a high frequency and low amplitude waves, which are there. These are known as alpha waves. And the stage one is just converting these alpha wave to beta and then going to delta wave. That is stage 3 and 4. So, and after in between, there are rapid eye movement sleep. So these are various stages of sleep. And usually we take it N1, N2, N3 sleep, and stage 3 and 4, they are now clubbed in N3 sleep. And it all depends upon the wave pattern in EEG, electroencephalography, the wave patterns. And the delta waves, the best thing to get into, and because these are the deepest sleep wave, and they have got low frequency, and that is high amplitude. So that is there. Whereas alpha wave have got low voltage, but frequency is very high, very high. So that is awake stage.
Okay. And there is one more question, which is about dreams. So Arvind ji कह रहे हैं कि I dream a lot at night. Is that normal?
Yes. It is normal, but it all happens in your the things which are there in your subconscious mind that gets activated during, specifically in REM sleep or stage 4 of you can say delta wave sleep, that deepest sleep. At that time, your subconscious mind is active, and whatever things you were having that goes inside your subconscious mind, they will start appearing in the form of dreams. And it may be positive dreams, it can be negative dreams, but it all depends upon how you perceive things and how your subconscious mind reacts to that. So that is it.
Yeah. Though of course we should be aware that hypoglycemia, severe hypoglycemia, can
Yes.
present as nightmares, as very bad dreams. तो अगर बहुत भयानक भयंकर सपने आ रहे हैं, खराब सपने आ रहे हैं, if you're getting extremely bad dreams, nightmares, that can be a sign of low glucose. And if you are taking insulin or you are taking other drugs for glucose lowering, no harm in checking your glucose at 3 a.m. just to see whether it is low or normal. Doctor, we have spoken so much about sleep, about Somno metabolic syndrome, but now a question coming from the audience is, what can we do about it? So what is the concept of sleep hygiene?
Okay. So it's a very important. We must learn how to, because as the environment is changing and there are so many stress and there are so many inputs coming up, and your mobile is the biggest input that comes up within every second you hold on your mobile, and this is the thing which you hold on maximum in your life. So this is the time it's a big mobile era which you are having. So maximum number of inputs are coming to us. So we have to have a proper sleep hygiene or a methodology to have a proper sleep. So that indicates it should be something like fixed time sleep, that you have to fix a time for your sleep, number one. Suppose you fix a time for around, say, आपको 10 बजे रात को सोना है. Ideally, it should be 2-hour gap between your sleep time and the dinner time. So dinner should be finished at 8 p.m. So it should be finished that. And the dinner quality and quantity is also important. Light dinner and lesser spicy, less fatty diet, less carbohydrate diet and more of fiber diet and protein diet is also very good. So if you do it, your better hormones will be produced. You will be having more sleep promoting hormones. Like your melatonin will be activated, your adenosine will be activated, your GABA will be activated if you just change your diet. Then fixed time. It's a circadian clock system, and that should be a fixed time also. So you have fixed the time of 10 p.m. Before that, stop watching TV. That is very important. And if you're watching TV, it should be very, very light type of some show or some music light, or you can have some jokes or something like that. You can, but not horror type, not fiction, not news media, because that is also a horror story which is going on every time. So news and all channels, they had to be stopped. Even cricket also, that also, and games also, that also produce some sort of stress, because you are bound to some team, and you have got some favorite hero that is playing your player that is there, so you will be attached to that. So it is better to stop all these things, because you should not involve emotionally to anything. So it should be a passive type of listening and passive type of viewing. Then go to sleep, and at the time of sleep you have to have very dim light, or you should stop, or no heavy light should not be there, no heavy sounds, no heavy music, and your own routine environment, that should you take care, change. And some may be having some habit of taking a light bath or washing their hands and feet. That also helps you to that giving a cue that you are going to sleep. And so it should be a disciplined way. It is not that you just think that abhi khana khaya, baatcheet karte karte chalo sote hain. Not like that. And don't discuss anything heavy before sleep. And bedroom should be a bedroom. It should not be a discussion room.
So basically all, I think, principles of common sense.
Yes.
Simple Vivek ki baat, common sense ki baat, but is common sense common these days, Dr. Suri?
Yes, it's not common, because we start quarreling once we go into the bed. कि आप लेट आए थे, आप ये है वो है, तो सारी कहानी वहीं शुरू होती है. So sleep hygiene is now it's very, very important to learn again how to sleep.
Dr. Annamalai, thanking you, and actually paraphrasing what you have said in simple words. So I will quote what Dr. Annamalai says. To put it very simply, insulin resistance and inflammatory markers increase if one is sleep deprived. So therefore, adequate sleep is certainly one form of treatment for type 2 diabetes. Therefore, when we prescribe treatment for diabetes or for obesity or metabolic syndrome, even hypertension, heart disease, we must include adequate sleep in addition to diet and exercise as part of lifestyle modification. So thank you, Dr. Annamalai, for sharing that. Now, question comes, Dr. Suri. We are speaking of sleep hygiene, but still there will be times when people need medication. So
Yes.
what is the routinely used medication, the conventional therapy, and things that we used when we were students, you and I, to prescribe, and what are the disadvantages of conventional therapy, benzodiazepine therapy?
Yes, yes. Now actually the how to treat sleep, it has changed, because now we have picked up or pinpointed certain hormones which are sleep hormones, which are nighttime hormones, and what are the daytime hormones. We have we are in an era of precision medicine. At that time, everything was a blanket treatment. We used to have barbiturates, benzodiazepines, and barbiturates are one drug which are basically for anesthetics. So like phenobarbital or primidone or scobarbital, these are basically for anesthetics or anti-seizure medications, because they decrease CNS activity, they decrease muscle activity, they decrease heart rate, they decrease respiratory rate. They are GABAergic, gamma aminobutyric acid, and they decrease sleep and wake, and they are sedative, they are anesthetics, and even they can lead to even overdose, can lead to coma and death also. And they have got lot of interaction, and we have seen patients with alcohol intake, and once they combine with barbiturates, they fare very bad with their outcomes. Then benzodiazepines came, which were slightly better in comparison to barbiturates. They are basically sleep inducers and sedatives. They are also working through GABAergic pathway, but they are less toxic, you can say, and less addictive in comparison to barbiturates, but still they are addictive. So we were having these two medications, and they are basically sedatives and hypnotics. Sedative used to be calm down something, or excitement going down, or activity going down, where hypnotics were usually natural sleep inducers. But now we are into era of precision medicine. We know which are the hormones which leads to awakeness, and which are the hormones which lead to sleep. So we have picked up certain molecules are coming up, like lambroxant molecule is there, which is a very good molecule. We call it DORA. We have moved from an era of GABA to DORA, that is dual orexin receptor antagonist. So they are the blockers. So orexin 1, orexin 2, these are the receptors. And if you block them, then the wake cycle is stopped and the sleep cycle starts. Your melatonin will start working, your GABA will start working, and you will have proper sleep. It is not only induction of sleep which is important, because many times we have seen like those patients who are on benzodiazepines, वो कहते हैं डॉक्टर साहब अल्प्राजोलम लोराज़ोलम एक बार आ जाती है, but डॉक्टर साहब टूट जाती है बीच में, and ultimately in the morning and the drug level is there, then they feel shaky, they don't want to go to school or don't want to work in the office, and also while driving there is a big problem. So, and they are always unsteady, specifically in, and there is certain that slight memory loss can be there in the early morning hours with usage of benzodiazepines. But if you have a molecule and then it is non-addictive molecules which are coming up, and there is one molecule lambroxant for pharma, and they are basically they have launched this molecule in a 2 strength, 5 milligram and 10 milligram, and OD dose is there, and the excellent molecule which I am using in my own practice, and there is no addiction, absolutely no addiction in my patients, and there is least amount of side effects. Yes.
So the shortcomings of the previous medicines, जो पिछली दवाई देते थे, उसकी जो कमियां थी, some of them were respiratory depressants.
Yes.
Others were cardiovascular depressants.
Yeah.
And in an era when you are prescribing so many drugs for the heart, you never know which drug will interact with which. And then you might end up getting a prolonged QTC interval. You might end up getting bradyarrhythmia. Arrhythmia हो सकते हैं, दिल की धड़कन में गड़बड़ हो सकती है. So that was one issue, respiratory and cardiac depression. Another issue was cognitive dysfunction. If you give, let us say, alprazolam or clonazepam, then certainly there is a slight amount of somnolence, cognitive dysfunction when you wake up in the morning. That was another issue. And third was, the third big thing was, they help in induction of sleep, but not in maintenance of sleep. So, बीच में नींद खुल जाती है. You might end up getting up at 3 a.m., 4 a.m. And then the fourth thing, of course, is the addictive potential. You end up making the patient addicted to it. But now, like you've said, we have newer drugs. तो ये नई दवाइयां हैं हमारे पास. One example you've taken, that is lemborexant. So, Dr. Saab, एक question रहेगा. Now, somebody comes to you complaining of poor quality sleep. You've tried sleep hygiene, things don't work. Will we jump straight away to medicine, or are there any tests that you would want to do to find out the reason for poor quality sleep?
Definitely, we should go with the sleep studies. And there are two type of tests which are available. Now we are having, the gold standard is basically polysomnography. For that, patient has to be admitted and patient has to be on certain channels also. Like there are various things which record during the sleep for the sleep quality and quantity and sleep related disorders to diagnose and the pinpoint the thing. Then it is known as polysomnography. There are 7 or more data channels which are included in polysomnography, and for that you have to get yourself admitted for the night. There is EEG they are doing, their electro ophthalmogram which they are doing, there are electromyograms which they are doing, and also there are ECG leads which are there, and there are respiratory channels, and there are saturation or pulse oximeter which are also there. And we decide which type of sleep disorder it is insomnia, or it is obstructive sleep apnea, or there is restless leg syndrome, or there is myoclonic jerks which are there. So we decide which type of sleep disorder you are facing. And now we are having certain even modalities which can be which you can do at home also. So sleep studies can be done at home also. There are certain newer advancement like ResMed has made one instrument which can be put on your finger, and also there is Garmin watch, Vivo Smart 4 watch, and there is Fitbit also is there, and that they also calculate the duration of sleep, type of sleep, what were your movements during sleep, how much your oxygen saturation dipped down during sleep, what was your heart rate, what was your pulse rate. So they are all very important, and they can give you a cue that you are in having some sleep disorder, so that you can go for polysomnography.
So that's good information. अगर आपको नींद नहीं आ रही ठीक, तो एक बार डॉक्टर से बात भी करें, टेस्ट कराएं. अब ये जो नई दवाई है, how do we start it? मतलब normally practice में आप किस डोज में स्टार्ट करते हैं? What time of the day do you advise patients to take it? And anything else do you take with water, with milk, with tea or coffee at night? What do we do?
Yeah, the one thing is that it has to be taken at night. Then specifically at least 1 hour or 2 hours before the sleep. That is the best part. With or without food doesn't matter much, but the diet should have light. It should not be heavy diet. Less amount of fatty diet that should be there. And with water or milk, it can be taken. There is no food interaction. And also most of the time, the routine prescribed drugs, they don't have any interaction with it. So it can be taken at night. It is taken at night, and at least 1 or 2 hours before meal, before going to sleep. And OD dose 5 milligram we start, and most of patients they will respond to 5 milligram. And even still, if there is any issue, then you can go up to 10 milligram.
Right. So ये जो आपने कहा no food interaction, so this means I can take it before dinner, during dinner, after dinner, or even if there is no dinner.
Yes. No problem.
How about people who take alcohol at night?
Okay. Actually, alcohol itself induces sleep also, but it leads to fragmentation of sleep. So best is to avoid alcohol intake once you are taking this molecule, but there is no additional sedation or additional damage, just like you have got barbiturates or benzodiazepines. When you add alcohol, there will be more sedation. You can even go into coma. Your heart rate and your respiratory rate will go down very significantly, and you can lose, even your breathing can be stopped. So, and also deaths have been reported. But here, the interaction is not that severe. It is not that severe, but amount of alcohol, definitely, it should be curtailed. It should be curtailed, not more than 40 to 60 ml drink that should be there.
People who are planning pregnancy, कोई महिला प्लान कर रही है प्रेगनेंसी, या प्रेगनेंसी चल रही है, या बेबी को दूध पिला रहे हैं ड्यूरिंग लैक्टेशन, इज द ड्रग सेफ, सर?
I think that it is not safe for during pregnancy and during lactation, it is not safe. But sleep hygiene and sleep is very important for whole of the pregnancy and your baby growth, and also proper fertility. Sleep has got its own effect on your reproductive system, and even child growth, and even during pregnancy, sleep is extremely important. And that time, I will shift my patient to melatonin. So melatonin is another drug, which is another hormone that is a sleep promoting neurotransmitter that you can use. Melatonin is available in 0.3 milligram and 5 milligram dose. That is also very good, that you can use in, that is very, very safe. That is a natural way of inducing sleep.
So this answers a question by Harish ji, who said, what is the best drug? You've spoken of lemborexant, and in pregnancy, you've spoken about melatonin. But Dr. Annamalai adds to the discussion by saying that one other treatment of insomnia is just to reduce stress. So like you said, not only sleep hygiene at night, but autonomic hygiene throughout the day. So what autonomic hygiene means is that you reduce stress, or maybe Dr. Annamalai, not reduce stress, you improve your response to stress, how you cope with stress. Reduce catecholamine release, that will lead to less insulin resistance, more insulin sensitivity, better quality sleep, and you will be able to break the vicious cycle. ये जो vicious cycle है sleep का और metabolic syndrome का, वो टूट जाएगा अगर आप stress कम करें. Arvind ji comes back to the question of continuous dreams. तो आपने आंसर तो किया था इसको, but so Arvind ji, one thing I can think of is कि अगर बहुत खराब या भयंकर सपने आ रहे हैं, तो या तो आपके ब्रेन में शुगर कम है, which is the commonest, हो सकता है नमक भी कम हो, ऑक्सीजन कम हो, ऑक्सीजन की कमी हो. तो दरवाजे खोल के देखें, विंडोज खोल के देखें. If you're using an air conditioner, you still might benefit from keeping one window open. एक पानी रख लें खुला, keep some water in the room. There might be lack of humidity or lack of moisture also in the room. तो ये चीजें करके देखें एक बार. जो एसी की जाली है उसको साफ करें. You clean the filter of your air conditioner. So these are some things I can think of. Apart from that, Dr. Suri, anything else? 25 years से dreams चल रहे हैं.
Okay. So actually we search about the thing. We have to look about what type of dreams this patient is having, and definitely they will indicate some sort of metabolic disorder. That is not maybe you are study. That is also very important, because there is something happening during sleep that is we have to diagnose it properly, pinpoint the thing, where is the issue, what type of either some habituation is there, or some continuous stress is going on, some anxiety, some psychiatric disorder is there, some epilepsy, some drug induced side effect like beta blockers, like when we are using atenolol, they were causing insomnia, and also they were causing bad. Your sometimes your SSRI, SNRIs, these are antidepressants, they also lead to bad dreams. Similarly, certain anti-epileptics that can also lead to bad dreams. Certain cardiovascular drugs can also lead to bad dreams, like your lenoxin can lead to bad dreams. So and even sometimes metformin can lead to bad dreams, and also insomnia can be there due to metformin. So you have to search out a whole list, what is why a patient is having. You have to search out the drugs, you have to search out the dietary patterns, you have to search out the living pattern of the patient. So it's a huge list of causes where you can have continuous, right from the psychiatry to the medicine part.
And in general, Arvindji, if they are happy dreams for 25 years, then you remain happy. Another 50 years more to go. So, agar happy dreams are rahe hain, to mast raho. And if the dreams reflect your daytime activity or daytime concerns, then that is also no. Lots of questions. मैं इसका answer देता हूँ धीरे-धीरे. The question is, what is the trade name? What is the exact name? So, the trade name is Dayvigo. D-A-Y, Dayvigo, V-I-G-O. Basically, daytime vigor, daytime vitality. Available, like Dr. Suri said, as 5 and 10 milligram. that the generic name is Lemborexant. अब जो लैम्बोर्गिनी गाड़ी है जो 3-3.5 करोड़ की है एंड जो डॉक्टर सूरी खरीदने लगे हैं अगले साल, दैट इज लैम्बोर्गिनी LAM, बट यहाँ पे जो हमारा जेनरिक नेम है दैट इज Lemborexant, 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 but the trade name is much easier to remember, that is Dayvigo. Another question, this is regarding vitamin D. तो क्वेश्चन आ रहा है सतीश कालरा साहब से, vitamin D deficiency also leads to insomnia, and iron deficiency can lead to restless leg syndrome.
Yes.
Are
Yes.
these also associated with diabetes or aggravation of diabetes?
बिल्कुल बिल्कुल B12 deficiency can.
So B12 can cause deficiency can cause neuropathy, which can be painful. Iron deficiency can cause restless leg syndrome, which is also quite troublesome. It causes insomnia. And vitamin D deficiency will lead to neuropathy, myopathy, and osteopathy, everything actually put together. So we should be covering this. But Satish Kalra साहब, ये जो vitamin D deficiency है, इसका musculoskeletal health के साथ तो बहुत लेना देना है. So if you have musculoskeletal dysfunction, certainly we must do. For metabolic optimization, it is obviously necessary that we give adequate vitamin D. But whether vitamin D will alone treat heart disease or alone whether it will treat diabetes, that is questionable. But of course, you must optimize. So we'll repeat the name again. This was from Ashutosh ji. Dayvigo. Daksa, would you like to repeat the name again and the indications, please?
Yes. Trade name Dayvigo, and the Lemborexant is a salt. 5 milligram and 10 milligram are the doses, 2 doses which are available. Oral tablet, which the indications are, and I am using in conditions where the patient having some like post-stroke insomnia, like cognitive impairment is there, or you are worried about amnesia or dementia part, patient having heavy alcohol intake, and then with light amount of alcohol, he can take it. Patient want to withdraw from benzodiazepines, again, you can shift your patient from benzodiazepines to Dayvigo. But patients who are addicted to barbiturates and benzodiazepines, they are very, very tough. If you see the receptors, number of receptors for benzodiazepine, the GABA receptor, they are perfused, large amount, the whole of the body organs they are having, whole the brain is having GABAergic receptors, whereas orexin, they are very limited, just 5%. So if you have got perfusely active drug and de-addicted this patient, it's a very, very tough job. Only psychiatrist people can do it, and they can remove this benzodiazepine, washout can be done. But ultimately, this molecule is very safe in routine practice, no drug interaction most of the time. And also it is cardio safe, renal safe, hepatic safe, even in hepatic encephalopathy patients, my early hepatic encephalopathy patient, irritable, you can start with 5 milligram dose. There is no problem. There is no problem of increasing encephalopathy that happens with, and you are always worried which molecule to be used during hepatic encephalopathy. Renal impairment patients which are having so much amount of sleep disorders and anxiety and restless leg syndrome and uremic symptoms, then you can have this 5 milligram dose. That is very good. And cardiac patients, and even in those patients who are having delirium, early delirium, they can be given this, and daytime melatonin and nighttime dose of Lemborexant, that can be given. That can be combined together also.
So basically the indication is if you need help to induce sleep and to maintain sleep, either
yes.
or both of the above.
Yes.
And it is very safe for use if there is any dysfunction in terms of renal, hepatic, इसका मतलब kidney का या liver की कोई दिक्कत हो. Also if there is any cognitive or psychological dysfunction,
yes.
दिमाग की सोचने की शक्ति में या behave करने की शक्ति में भी कोई दिक्कत हो, तो भी ये दवाई दे सकते हैं, and it is safe. अल्कोहल डी एडिक्शन में भी यूज की जाती है. और एक और जो हम इसे इस्तेमाल कर रहे हैं प्रैक्टिस में, बहुत सारे हमारे पेशेंट्स आते हैं जो कहते हैं जी डॉक्टर साहब मेरी दिन की शुगर ठीक है, माय डे टाइम ग्लूकोज इज परफेक्ट, मगर मेरी खाली पेट शुगर ज्यादा आती है. नाउ देयर आर मेनी रीजंस फॉर दिस. हाउ वी एक्सप्लेन इज के जो दिन की शुगर है उसका दिनचर्या से लिंक है. योर डे टाइम शुगर इज लिंक्ड विद योर लाइफस्टाइल. Your lifestyle is sattvic, it is good, that is why your daytime sugar is good. But at night, the glucose comes from the liver because of gluconeogenesis. So the liver is not able to respond properly to the ambient glucose levels. But it is also possible कि रातचर्या जो रात का lifestyle है या maybe quality of sleep वो ठीक ना हो. That is why there is a fasting hyperglycemia. It can be associated with excessive release of catecholamines. तो इसको कम करने के लिए also you can try a therapeutic trial of lemborexant in some of your patients who are complaining of insomnia, disturbed sleep, and also high fasting glucose. So that's another indication where we are using it. We are using it to benefit. Doctor साहब ने एक बात की कि you can use the drug to help in benzodiazepine withdrawal. So Doctor साहब, roughly we have now 5 and 10 milligram. Let us say somebody is taking, maybe just as an example, let us say 1 milligram of alprazolam or 1 milligram of clonazepam at night, and they're trying to leave but they can't leave. How would you want to introduce lemborexant, and how would you want to taper off the benzodiazepine? So I think we've lost Dr. Suri, but the basic style is to go stepwise. No single rule will fit everybody. हर एक के लिए एक रूल नहीं लागू होगा, मगर मान लो मेरा पेशेंट alprazolam या clonazepam 1 milligram पे होगा, तो I will reduce that to 0.5 and I will add lemborexant 5 milligram tablet. I will also tell the patient that feel free to take an extra 5 milligram if you feel like, don't worry. And अगले हफ्ते 2 हफ्ते में धीरे-धीरे we try to minimize the benzodiazepine intake. Patient को ये भी बोलेंगे, don't get disheartened if every now and then you have to take the drug. Count your weekly intake or count your monthly intake. Supposing last month your monthly intake was 60 milligram of benzodiazepine, or maybe 300 milligram of diazepam. This month it has come down to 30 milligram or to 10 milligram. That is a great achievement. So you keep your patient happy that way. Dr. Suri, your practice, any clinical pearls, how do you help patients to shift to lemborexant, to this non-benzodiazepine sedative?
Yes, it has to be, if the patients who are already on benzodiazepines, you have to go very slow because they are somewhat dependent on that. And we have to go very slow, but 5 milligram lemborexant can be added because whatever benzodiazepines are doing, they are sleep inducers. They don't increase the whole time sleep duration. The duration of sleep is increased by lemborexant. The patient will feel better. They will feel, okay, I was okay with the 10 milligram of zolpidem. Now you added this. Now I will be taking half of zolpidem. I can move to alternate day of zolpidem, and slowly that can be withdrawn. So, and you can build up the dose of lemborexant. This is very good thing, that you can withdraw these molecules which have got toxic effect, which have got addictive effect.
Pradeep Gupta ji पूछ रहे हैं the trade name of melatonin.
Okay, there are many companies. Melatonin is there. You can have any, you can search out, and I'm writing melatonin. You can have, and there are so many companies which are having melatonin, but use pure melatonin. Don't try to use in combination of other molecules. They are there. So try to use pure melatonin, 0.3 milligram. 0.3 milligram and 5 milligram.
3 milligram, and don't use in combination with alprazolam. Otherwise, that will defeat the entire purpose.
Yes. So a 3 milligram dose of melatonin is sufficient. Most of the time, it is sufficient to have your effect.
One other question from Dr. R.S. Chaudhary, and that is how long you can take melatonin and Davigo.
See, long-term studies, which Sunrise 1, Sunrise 2, that was not that prolonged studies, but at least for, ultimately you have to change your sleep hygiene. That is the thing. And you have to reduce body weight if you are obese. You have to stop smoking and alcohol, and whole, you're thinking towards, you have to have a healthy lifestyle. That is more important because it's a natural phenomenon. You're taking a bridge course, a course of these molecules. You are having only a leeway that you are not able to manage till that, say, if to 2 months, 3 months, or 6 months. And mostly my patients feel that now after 1 month, I don't want to use this molecule. Somehow it sets your sleep cycle in a proper way. Same is your melatonin. Melatonin will help you in 1 month or 2 months. Your cycle will be settled, and that was the purpose of these molecules.
So there are some diseases which are structural. Like let us say you have an injury, which may be permanent, which may be temporary. There, your approach is different. But there are others which are functional. So functional means like, maybe there is enough testosterone in the body, but the testosterone receptors have stopped responding. Similarly here, the DORA receptors may, the oxygen receptors may stop responding for a multitude of reasons. So you begin the drug, you institute sleep hygiene practices, comfort and counsel and make the patient confident कि हम आपको ये दवाई दे रहे हैं for a short period of time, let us see how things move. And कई बार दवाई बंद भी हो जाती है, कई बार चल भी पड़ती है, and ups and downs will be there. It is a chronic kind of a management, तो ups and downs आते रहेंगे. एक और क्वेश्चन साहिल साहब का आ रहा है और साहिल साहब पूछ रहे हैं कि सर यू स्पोक अबाउट somno metabolic syndrome and initially we spoke about obstructive sleep apnea which can also disturb sleep. तो obstructive sleep apnea के लिए any clinical markers, how do I know in which patient to get the sleep study done? Is there any questionnaire, any score that I can follow in my practice?
Yes. See, mostly obstructive sleep apnea, whatever routine perception is that it happens in obese patient. When we would think that there is neck circumference is on higher side, then it will happen. So obese patients are much more prone for obstructive sleep apnea, but even you can have in lean body weight or normal body weight patients, they can have obstructive sleep apnea. There are usually three types of sleep apneas. Obstructive sleep apnea, there is central sleep apnea when brain is involved. When you take, say you are having alcohol addicted or drug addicted, your brain is involved, or post-traumatic. And then there can be combined. You can have OSA, CSA combined also. Complex sleep apnea syndrome can be there. Now, the first common symptom, where the indication is loud snoring. And snoring is the most important trigger point where your spouse comes and one or any family member comes ki doctor sahab snoring itni zyada hoti hai, routine amount of normal snoring, okay, or having you have got closed nose or stuffy nose, then it is okay. But if it is a loud snoring and you are not knowing it, and once you, and even during that sleep you wake up, you are gasping for air, this is 100% sleep apnea. You are gasping of air, it is 100% sleep apnea. And in the morning, you are irritable, you are having headache, you are having daytime increased sleepiness, this is 100% OSA. So now you have to find out, document whether it is mild or moderate or severe. There is apnea hypopnea index, AHI index. If it is more than 30 episodes in an hour, this is severe. If it is between 15 to 30, it is moderate sleep apnea. And if it is 5 to 15, it is mild sleep apnea. And normally it should be less than 5. And these type of episodes of apnea of 10 to 20 seconds happen around 400 times in night. So they are very frequent. So they are very, very frequent. And they have got all these signs and symptoms. So you go for polysomnography and you will detect it. And even your simple watches and also ResMed of that modality of wrist watch, that can also, the finger, that the device can pick up the sleep apnea.
One simple question is the stop score or the stop bang score. So stop stands for S for snoring, T for tiredness during the day, O for observed episodes of apnea, and P for pressure, blood pressure treatment. तो एक पॉइंट स्कोर करेंगे अगर आपको स्नोरिंग हो रही है नाइट में, टायर्डनेस दिन में, टायर्डनेस ड्यूरिंग द डे. O for observed, if other people observe that you stop breathing while sleeping, and P is if you are taking treatment for blood pressure. So this is stop, very easy to do. Bang में थोड़े से नंबर नापने पड़ेंगे. You have to check a few numbers which are all easy to do. B is for your body mass index or body weight. Now A is for age more than 50. N is for neck circumference. Just look at the collar size. In men it's quite easy. Your collar size is the centimeters of your neck. And more than 40 means high risk. And G is for gender. If you're male, you add 1. So that is stop bang. And this will help you screen for obstructive sleep apnea, which is another important determinant and characteristic of somnometabolic syndrome. Dr. Anamlai also points out that even with Davigo 5, sometimes there may be daytime sleepiness. So SMA, you can reduce the dose. You can change the timing of administration. So maybe patient says, I am taking the tablet at 10 p.m. You can say, why don't you take it at 8 p.m.? Have an early dinner, early supper, and take the tablet early as well. And इसके साथ वो जो circadian rhythm वाला है, early to bed, early to rise, that will also be taken care of. And of course, you can always change over to melatonin, like Dr. Anamlai says. So, Dr. Suri, it's been great being with you. More than an hour and pata hi nahi chala. We never realized the time. So many questions. Yes. And Dr. R.S. Chaudhary sir saying excellent talk and thanking you for your pearls of wisdom. With this, I'd like to thank everybody. सबको शुक्रिया करना चाहूँगा for being with us on this episode of KK Med Talks. जैसा कि आप जानते हैं, हम आपके साथ रोज होते हैं 7 से 8 बजे. We are there every evening 7 to 8 p.m. और मैं ये होस्ट करता हूँ शो 7 to 8 p.m. on Mondays and Thursdays. So I'm with you every Mondays and Thursdays. And each time we try to bring a different aspect of health to you. तो आज का हमारा टॉपिक था हेल्थ एंड मेटाबॉलिक सिंड्रोम, सोमनो मेटाबॉलिक सिंड्रोम. A very difficult topic, बहुत मुश्किल topic. But Dr. Suri ने इसको इतना आसान कर दिया. He made it so easy for us and so simple to understand. And Dr. Suri, before we conclude, people watching you from across the country, we have physicians, we have neurologists, we have diabetologists, people from every walk of life, actually. So your take home for everyone.
See, sleep hygiene is extremely important. Take care of your day workout, but also sleep. You should have a proper hygiene of the sleep and take consideration that you should have a proper sleep. So sleeping you have to make it a lifestyle modality, that your lifestyle, and that should be included. Just जैसे आप लोग एक्सरसाइज करते हो सुबह, जैसे आप अपने डाइट का ध्यान रखते हो, इसी तरह अपनी निद्रा का भी ध्यान रखिए, क्योंकि ये बहुत इंपॉर्टेंट समय है. आप देखो ना, 24 घंटे का रात, आपका आधा समय तो आप लोग को रात को निकालना है ना. तो यू हैव टू टेक केयर ऑफ योर सेल्फ ड्यूरिंग नाइट. सो वो नाइट टाइम आपको कैसे बिताना है उसके ऊपर आपका डिपेंड करता है. नाइट टाइम, लॉन्ग टाइम सिटिंग, व्यूइंग ऑफ स्क्रीन टाइम, और ये जो दीज थिंग्स आर वेरी वेरी बैड. एंड और इसी से ही हमारा नेगेटिव इम्पैक्ट पड़ा है हमारा सारा मेटाबॉलिक सिस्टम पे.
And like we started in the beginning, I am suddenly inspired by the region of Arunachal Pradesh, Dongi Polo, and I am inspired actually to learn more about that. So सूरज और चांद की ये नहीं कहेंगे कि आप पूजा करें, बट उनकी इज्जत करें. डू रेस्पेक्ट द सन एंड द मून, बिकॉज दे हेल्प यू ब्रिंग बैलेंस टू योर लाइफ एंड दे हेल्प यू ब्रिंग स्ट्रक्चर, रिदम टू योर लाइफ. एंड इफ यू डोंट रिस्पेक्ट देम, then you get in trouble, and one of the ways you get in trouble is through somno metabolic syndrome. इसके साथ आप सबसे इजाजत लेते हैं. We'll take permission from you. Thank you, धन्यवाद, शुक्रिया, मेहरबानी. जय हिंद.
Bye. Thank you. Bye.